So we're having a presentation of an umbrella review, an attempt to review all the systematic reviews that have been published on peer support. And here to present it are the lead author on the review, Ruth Cooper, who's a former postdoc researcher with the Policy Research Unit in Mental Health, and Karen Machin, who is one of our lived experience researchers in both the first and the new Policy Research Unit. And she's also co-director of the Survivor Researcher Networker. She's has a great deal of expertise in delivering and training people in peer support. And she's also one of the authors of this review. So over to Ruth to start that presentation. Thank you.
Hey, thanks, Sonia. Thanks, everybody, for coming. So I'm Ruth, and Karen is also presenting with me. And we're presenting a umbrella review, which looked at what the research tells us about peer support for mental health. And as Sonia was saying, this was conducted as part of the NIHR Policy Research Unit in Mental Health. So this is just our funding statement. So this is funded by the NIHR. And then I think Karen is going to talk you through this slide.
Just a little bit of background. I know that Andrew and Sonia have both introduced peer support and what it is. You know, it is a mutual, reciprocal, equal relationship amongst people who've experienced challenges of whatever kind. And peer support is very common and is something that we all draw on. And that it's been of increasing interest to mental health services over the last 15 years, but particularly within the last 5 years. With the response to the long-term plan in the NHS, and it has grown remarkably. It's recommended in policy guidance. You know, it is increasingly of interest, and including to researchers who have set out to understand what it is and how it can make a difference. And I'll hand over to Ruth to describe what we've done in terms of the research.
So there's been a lot of reviews of peer support conducted over the years. And so what we aimed to do was to summarize all the reviews that have been conducted to date. So we did this, so as you can see from this figure on the right, so we start with individual studies, for example, studies where you'd be interviewed about your experiences of working in peer support. So these individual studies are then summarized in what we call a systematic review. And we call this a systematic review because we use methods that aim to find all the studies that have ever been conducted in the particular area we're looking at, so in a particular area of peer support. So we then summarized all these systematic reviews in an umbrella review. So an umbrella review is a review of all the systematic reviews of peer support. And we aim to answer the following research questions. So we wanted to look at what is the effectiveness of peer support for mental health, what influences the implementation of peer support, and what are the experiences of peer support in mental health. And so this review is published and it's freely available. And I can put the link to it in the chat if that's not in there already. So I can do that after we've finished. So yeah, please do go and read the review. It's quite long and there's lots of detail in it. Okay, and so these are the steps we took to conduct the umbrella review. So to find the reviews, we searched 5 scientific databases where all the scientific papers are held. So for example, Medline and Embase. We used keywords for peer support when we searched in these databases. And then we selected relevant reviews, which reviewed paid peer support for children or adults with any mental health condition. And so we found 35 reviews which looked at this. These reviews included a large number of individual studies, so 426 individual studies. And each review included between 95 participants up to over 40,000 participants. So this was a big study. We then looked at the quality of these 35 reviews, and we found that the quality was generally quite low. So 97% of the reviews were low or critically low quality. We then extracted relevant data from these reviews, so data which looked at the effectiveness, implementation, and experiences of peer support. And we then synthesized this data to answer our research questions and wrote up our umbrella review. We've got a very detailed protocol, which is available online as well, which I can put in the chat after as well, if you're interested in the detail of the methods that we used. And then I'll just hand over to Karen to talk about our involvement of people with lived experience in this.
Thanks, Ruth. So in all of those many stages that Ruth just described, they all involved people from the lived experience working group. And Lizzie, who's here today, as well as myself, wrote a lived experience commentary for this particular study. These lived experience commentaries have been an innovation of the Policy Research Unit, as I think they're worth a mention. That's where papers have a section that is written independently by people with lived experience. And I think these commentaries work particularly well when we've been involved in the study itself, and we can speak from that experience. We can include comments that we might make, but that don't have a clear place in that sort of standardized format of a journal article. In this study, Lizzie and I used the commentary to highlight that the methodology of the study meant that various elements could not be included, such as the unpaid peer supporters, because this study concentrates on paid peer supporters. And also that the review is of academic studies, which are consequently looking at peer support through a specific lens, which is likely to be different from how we might look at it with a lived experience perspective if we were to start from scratch. And clearly we weren't doing that. And that's not to negate the study itself. It is what it is. I always refer to this particular study as being a line in the sand in 2024, summarising the breadth of academic work that's in relation to these three questions. But a commentary allows us to be that critical friend, pointing to some of these issues. And our hope as a team is that by voicing some of these concerns, we might influence future research. Ruth.
Thank you. Okay, so we're just going to talk you through the results. So in terms of the first research question, so we looked at what is the effectiveness of peer support. So how helpful is peer support for the service users receiving it? So this was reported in 23 reviews, but I'm just going to report the results from the reviews which included meta-analysis. So this is where reviews look at whether peer support works better than what we call a control condition. And that could be, it's often usual care without peer support. And then this data is statistically analysed, and it's considered to be the best way to look at effectiveness. So overall findings were quite mixed. So that means that a lot of studies found peer support was helpful, but then others found it wasn't any better than the control condition. So in terms of where we found peer support could lead to improvements, so we found evidence that peer support could lead to improvements for people with depression, particularly perinatal depression. It could help people to recover. It could lead to improved self-efficacy, so a belief in somebody's ability to reach specific goals. It could lead to reduced feelings of stigma, such as self-stigma. And then we found quite mixed findings for these outcomes. So some studies found peer support led to improvements, but some found it wasn't better than control. So we found mixed findings for empowerment, quality of life for service users, service use, such as rates of rehospitalization, and other clinical outcomes, such as improvements in help seeking, and also hope. And we didn't find any consistent evidence for an effective peer support on other mental health symptoms other than depression. So, for example, overall symptoms, satisfaction. So, for example, satisfaction with care, relational outcomes such as social network supports, and people's functioning. Okay, I'm just going to hand over to Karen.
So the next part of this project, I mean, it was such a large project and a lot to report back, but this is, we divide ourselves into several teams. I wasn't specifically involved in this section, which is looking at the implementation of peer support. And we use the consolidated framework for implementation research. I've used that framework for many years as part of my own practice, so it was reassuring for me to see that the results from the academic papers reflected what I'd seen in practice for the last 15 years or so. This table that we've got on the screen is just a very brief summary of the sort of the detail that's in the paper. So I'd really encourage people to go and look at the paper. There's so much more in there. The CFIR uses these 5 factors. The innovation of peer support itself is well accepted. That top one. The second one is around that outer setting. Really emphasising there that national policy initiatives and funding. We've seen the incredible growth in interest and since funding for training in particular was provided nationally by NHS England. In practice, that's felt like the main driver, and that's there in that outer setting. The inner setting is the organisation or the team where peer support is being implemented. And here we recognise the importance of culture, the culture of the team or the organisation, to ensure that that accepts and supports the introduction of peer support. The research mentions strong leadership at the highest level, that it recognising it can take one person to drive that interest in peer support. Whereas in practice, we might promote leadership at all levels to include the views of people who might use peer support and the people who might provide it, reflecting that emphasis on co-production and the importance of that. All individual people involved need to be supportive of peer support. I think that goes without saying, really, to promote that quality as well, about the skills and the ethics, as well as having some champions and thinking about recruitment practices so that the individuals are throughout the organisation, not just within that one particular team. And that final factor of the implementation process, we've found that that's the one that everyone wants to jump to, like, how do I do it? How do I get started on it? But I'd argue that those first 4 factors that we've described there are essential to build the scene for this particular one. The literature didn't say anything new to me about implementation, so it's really reassuring that emphasis that training needs to be provided for peer support workers, but also for the whole team. It's not just about the peer supporters, and that supervision should be provided for peer supporters. Ideally, I'd say by a senior peer support worker, so bringing that lived experience through to supervision. And everybody wants clear definitions, but I think we have to be mindful about maintaining the flexibility of the role. There is so much more detail in the paper, and I'd really encourage people just to go to that, really, because it's such a rich table within the article. If you go to the next slide, Kirsten, please. Oh, Ruth, sorry, yes, up to the slides, aren't you? Sorry, got Kirsten in my head. So another element that we looked at with the experiences of peer support, and this was included in 11 reviews, and it showed that perspectives from a real different range of mixed samples. So that would include peer support workers, it would include their clients, the people using their service, and also other healthcare staff. Some people refer to that as the non-peer staff within the organisations. So that was in 11 of the reviews, and we reported it in 3 themes. So we've got 3 slides. They cover what the role can bring, which I'll talk about here, and then there's confusion over the role and the organisation challenges and impact, which we'll come to later. So this slide, talking about what the peer supporters can bring, highlights that peer supporters bring something different. There is something around that authenticity of the lived experience that brings hope. It normalises and potentially demedicalises distressing experiences. It can bring an easier rapport and empathy, and peer supporters are fundamentally about recovery-oriented care. And that all impacts on the well-being of the peer support worker. Where it works well and peer support workers are valued, there's increased confidence and self-esteem. But there can be a flip side if it's not working as well, which can potentially impact on everyone's well-being, and that includes their colleagues and the people using their service. And there's also that concern, as raised in that one of the reports, that a sick label can stay with the peer support workers. That's not to undermine any of the many positives, and the differences that peer supporters can bring to the team can contribute to it. And I should perhaps also point out here that some of those elements we might question from a lived experience perspective. So, for example, I personally don't like the pressure to be a bridge or to be a role model. But that language doesn't sit comfortably for me personally, but we have to report what's actually in the reviews and what we've read in them. I'll hand over to Ruth to describe the other two themes.
Thanks. So our next theme was confusion over the peer support role. So within this we had made the main points of role ambiguity, boundaries, role conflict and professionalization, and disclosure of peer status. So, for example, with role ambiguity, the peer support role could often be experienced as ambiguous, and this could be positive as it gave flexibility to define the role. But it could also lead peer support workers to feel confused, which could affect their confidence and could lead to some uncertainty and responsibilities towards clients. Some issues around boundaries came up. So, for example, where to draw the line between friend and service provider. And there could be some confusion over when to disclose. So some peer support workers felt vulnerable and could be reluctant to disclose about their lived experience. But disclosure could build trust with clients and could also educate mental health teams on alternative views. And then our last theme was looking at organizational challenges and impact. And so within this, we had various challenges for healthcare staff and organizations: low pay, high workloads, a lack of support and training, colleagues and stigma, and treatment models. So, for example, in terms of low pay, quite a lot of reviews talked about role dissatisfaction due to peer support role not being well paid. And this could suggest that the job was new, not valued, or that it was unclear. Some of the reviews talked about a lack of support, training and supervision for peer support workers, which could mean that some peer support workers struggled to develop skills for their roles, such as working with service users with more complex needs than their own experiences. And colleagues and stigma. So some peer support workers talked about experiencing some negative staff attitudes. So, for example, not being invited to certain work events. It could lead to peer support workers experiencing self-stigma and feeling isolated. Okay, and then we'll just go on to our final slide, which just talks about the implications of our review.
It's 16 minutes, Ruth.
Oh, sorry. Yes, this is the last slide. So in terms of practice, so culture, hierarchical structure, and staff acceptability of peer support can impact implementation. So structural and cultural change could be required for peer support to succeed. So, for example, ensuring a recovery-oriented care model is operating in the service. In terms of policy, so successful implementation of peer support requires a co-production approach, and peer support really needs to be adequately resourced, so adequately paid. People need to have appropriate office space and access to resources. And lastly, in terms of research, as peer support becomes more established, more kind of research is needed over time, and we need better definitions of peer support roles. So, for example, the type of interventions to deliver, and more lived experience involvement in peer support research is needed. So, for example, in setting research priorities in peer support. That's the end of the presentation. Thank you for listening.